Dr. Gary Zammit, the President and CEO of Clinolabs Drug Development Corporation. And with me today is Dr. Eric Siemers, the Chief Medical Officer at Acumen Pharma. Dr. Siemers and I are going to have a conversation about Acumen and the work that they're doing there. Acumen Pharma is involved in the development of a new drug, ACU-193, for the treatment of patients with Alzheimer's disease. How do you define Alzheimer's disease? What is it?
Alzheimer's disease was first described by Dr. Alzheimer in 1906. And in 1906, he had a patient who was having substantial memory problems that we now actually know has a rare form of inherited Alzheimer's disease, but that wasn't known at the time. But Dr. Alzheimer in 1906 used what were then this new technology based on, and he obtained the brain at autopsy. So he had seen the woman in life and then had the brain at autopsy. And using these special stains, which were brand new at the time, found two different abnormal proteins in the brain of this patient. So one are what we would today call amyloid plaques, and those plaques that we now know are made up of a little protein called A beta. So we saw those, and those are outside the brain cells, kind of in between the brain cells. The other thing that Dr. Alzheimer found was what we call neurofibrillary tangles, which are a different protein called tau, and those tangles are actually inside the brain cells. So he actually, in 1906, identified these two different things that we continue to be focused on now. Now, you might ask yourself, if that was 1906, why aren't we closer to better treatments for Alzheimer's disease? There were a lot of things to be worked out in terms of what those proteins were, and then how they're metabolized, and a lot of recent technology has really helped us to understand those things, especially including what are called biomarkers, things that you can measure in a living human being, and you don't need an autopsy to start to understand the pathology. So it has taken a while since the initial description, but that's still how we define the disease, as having plaques and tangles.
So really, 120 years after, or almost 120 years after Dr. Alzheimer's original discovery, Acumen and other companies are focused on developing treatments that target what he found back in 1906.
Well, what he found in 1906 were the plaques and the tangles, and there are some programs that target either the plaques or the tangles. But what's only been understood to an increasing degree over the last, say, 20 years was the role of these A beta oligomers. In other words, you take the A beta protein, a few of those stick together and form an oligomer, and there's a fairly good consensus in the field now that that's really the toxic species. That's where the real problem is. But that body of knowledge has really only been developed over the last 20 years. And a lot of this is just due to improved laboratory techniques, things that Dr. Alzheimer couldn't have done in 1906.
And what would you say is the current standard of care for somebody who has Alzheimer's disease, even if they detect it early on? What treatment options do they have available to them?
For patients who have Alzheimer's disease currently, there are approved drugs for the disease. Now, we typically call the drugs that are available and approved now symptomatic drugs. And what happens with those is you'll make a diagnosis, you'll start one of these medications, and you see a little bit of improvement in memory and other cognitive functions. The problem with those drugs is that they don't do anything to the underlying disease. And so maybe for 6 months or so, you're a little better than before you started the drug. But by roughly 6 months, because the underlying disease has progressed, you're kind of back to where you started. So newer drugs that we're working on now are intended to slow disease progression. And the other thing in our trial and most trials now is if you're on one of these older symptomatic drugs, you can stay on those drugs and be in the trial. You need to stay on the same doses, but so you can be on standard of care and participate in one of these clinical trials.
So someone who already knows they have Alzheimer's disease or whose doctor suspects they have Alzheimer's disease and has started a treatment with something else, they'd still be eligible to participate.
They would be, yes. They would be eligible to participate. We would have to confirm that they, in fact, had Alzheimer's disease with a PET scan, but they're certainly eligible to be screened. And if they're ultimately found to have a positive PET scan, they can participate in the trial.
Well, thank you for all of this information. It really is a pleasure to be working with Acumen for us at CliniLabs and for the field in general.
Yeah, thank you, Dr. Zammit.